First of all, are you okay?
Good morning. Thank you for asking. I am okay. Are you okay?
I am okay. Thank you for asking as well. It's interesting. I mean, this day has been running for a few years now, but you kind of feel like it's got extra significance this time around.
Boy, it does, Peter. I have to agree with you on that. I think one of the things that we are seeing throughout our challenges, our ongoing challenges with COVID-19, wherever we may be in Australia, and our thoughts in particular go to our colleagues in Victoria who are still going through such difficult times. All of us have our mental health being affected. I think we're becoming familiar with the fact our mental health is part of it. It is being impacted. And for some people, they are going into places which are really quite dark. So it's incredibly important that today of all days, we do reach out and ask that very important question of, are you okay?
Do you have the figures, Christine, of the uptick in people who are needing help this time around, and in particular in Victoria?
Oh, look, we certainly do. We see increases across all of our major support lines and our specific ones. So Beyond Blue has had very significant rises. Year on year, it's about 44% up across the country, but in Victoria, about twice what it was this time last year. Kids Helpline, which is incredibly important for our young people, they have had an increase across the country of around about 38%, but again in Victoria, about 65%. Lifeline also. So we're seeing it across it, and that is good in that people are actually reaching out for help, but it makes it incredibly important that we are there for them.
So I'll pick you up on that point in a second, but I just want to clarify. So you've had a 65% increase in young people. Is that the kind of demographic that is needing more help?
Look, I think actually the only way I can answer that question is to say all groups need it, but we need to understand the particular vulnerabilities. So our young people in particular, if they're at school, are finding real disruptions to their education if they're trying to transition out of school. But we also are seeing increased rates of loneliness in people who live alone, and loneliness is a precursor to depression. So it's something we need to be really concerned about. We're seeing women and other people displaced from jobs. We're seeing really across the board, Peter, and I think the key thing we're realising is everybody has different vulnerabilities, so it's not one size fits all.
Well, I guess you've got young people who are worried about their future at the moment. They might be leaving school, and school's so fragmented this year. You know, are they going to be able to get to university? Are they going to have the same kind of career path that, you know, maybe their older siblings or whatever had? And then with the younger people, the older people, I should say, they've lost their jobs. They fall behind in their mortgage payments, and then they also wonder what's ahead. So all they can see is a lot of darkness.
I think that's it, and I think the challenges, we've got a few challenges in that. I think that one of them is for us to really hold on to the firm belief that we will get through this. And I think that as Australians, we can say we will get through it. In particular, to our young people, I say, look, the future does look grim for you. I understand that, but it is still yours. And you can actually make a difference. And I think the other two things we need to do. Firstly, we really need to have what I call a sense of self-agency. How can I, with all of the restrictions around me, still establish my routine, still do those things which bring me pleasure? How can I still flourish in the circumstances? And most importantly, singularly, the most important is to stay connected with each other. We're really finding that that is the best protective factor for all of us.
It's so easy to say, though, and hard to do, to flourish when, you know, you fall behind in your mortgage payments, you've lost your job, you know, and I note today that the government's chipping in another $19 million in suicide prevention programs. How does that help when people have got their backs up against the wall and they can't do anything?
Oh, look, a really good question, Peter, because I think we have to not see our mental health supports as a panacea for solving those really underpinning, challenging situations that people are finding themselves in. If somebody is feeling the real pinch of financial insecurity or have lost their jobs, they must engage with the specific services that can help them try and untangle and find a way forward. But in addition, and I think this is the key point, in addition, because those circumstances are so stressful, they do impact on our mental health. So mental health services need to come together with those other services. We need to join up and actually realise that people are whole and we have to help them with their particular problems and also provide those mental health supports so that those levels of anxiety, fear, depression can be managed.
The figures this morning suggest that back in 2018, more than 3,000 people passed away from suicide. And you did bring up this point a little bit earlier that you feel like people are reaching out for help more than they used to. Are you seeing a big uptick in that? And is that something that kind of gives you hope that it's working?
Look, we certainly are seeing more people with more what we call severe mental health challenges and what we call suicide ideation, which is where you have thoughts around it. And we see some really risky behaviours happening. So the challenge for us is to make sure that we always maintain a sense of hope. We always maintain a sense of connection with people, and we help them avoid those crisis situations. That is the really important thing we do. I know it's a really hackneyed phrase now of stay ahead of the curve. We've heard that for months. But in fact, it really applies to mental health as well. We have to actually stay ahead of people becoming in circumstances that are crisis for them. And we actually have to say there are ways forward.
Yeah, very important information to know. Christine Morgan, appreciate your time this morning. Thanks so much for joining us here and talking about it.
Thank you so much.